So one of the things that happens when you are moving through your cancer recovery phase is it's a long time between things happening. So today is the 19th of October and it's currently Breast Cancer Awareness Month. But I wanted to speak into and remind myself today of the fact how breast cancer doesn't necessarily leave us quickly. So all the cells have gone, all of the treatment has been done. I'm still trying to get my migraines under control, and the fatigue has kicked back in over the last couple of weeks. Now I had two things happen. One, I had this funny thing come up on my hand, and I'm an Australian, I'm nearly 50, so skin cancer and melanoma is a thing here. So I saw this lump come up on my hand, it looked unfamiliar, so of course I had this thinking that I had a skin cancer, and of course very quickly my brain went to not just skin cancer, it's going to be a melanoma and it's going to have spread. It was actually a splash burn from some oil out of a fry pan, and it came off quickly and there is no issue there. But that was my first realization that even though I have done everything I knew how and everything that was reasonable to me to avoid the breast cancer coming back, I still live with some of this fear that it's going to come back. And to me, that has now been created something intolerable. The thought of having to go through chemotherapy again triggers me to migraines, makes me nauseous, and is really difficult for me, really difficult. As you can hear, it's really difficult. Now, over the last few weeks, I've had some strange things going on with the skin in my armpits. Weird, I know, but anything about cancer treatment is weird for women, right? We've talked about that before. So following the lumpectomies and then following chemotherapy, where things happen, I have found it really difficult to use antiperspirant deodorant. It actually stings my skin, even with hair growth there. It really stings. So I chose not to use antiperspirant deodorant, and I started using a more natural deodorant, and that had been fine. But then probably a month ago, the under my arms got incredibly itchy, like intolerably itchy, and I was using something else. I had some steroid cream left over from something else, so I was using that to help get the itch down. Then I noticed that the skin was breaking down, and it looked like I had some sort of contact dermatitis or some sort of dermatitis happening in the skin on both. I thought that's probably a bacterial infection. It's quite possibly from it being more moist in there, and so I stopped using anything deodorant wise. I used some betadine, and I thought that I had killed that infection off because I hadn't been having any problems and I hadn't gone back to using deodorant. It's interesting how your body recovers from things like deodorant. Well, over the last week there has been a pain and discomfort growing in this under my left armpit, and now there is a very hard, red, inflamed, defined lump there. Now it could be any number of things, and of course I've done the thing that we always say we shouldn't do, which is I've googled it, and I've got everything from an ingrown hair, so an infected hair follicle, although what looks like there doesn't look like any of the pictures I found on the internet. It could be a progression of my autoimmune condition, so more lupus type symptoms, which I've kind of had a suspicion of previously. Or, in my brain, I am now dying of stage 4 metastasized breast cancer. Yesterday, when I started having this discussion, and so it's Wednesday, Monday I made an appointment to see my GP, and Monday, which was yesterday, today's Tuesday. Anyway, earlier this week, I started talking to my husband about it and let him know it was there, asked him to have a look at it, asked him if he could feel it, which he could. The first time I asked him to feel it, he was like, yeah, it just feels like there's a bit of a tight muscle under there, which could make sense with the shoulder rehab that I'm doing. And then the next time I asked him what he could feel, he went, there's something extremely definitive there, and it's now angry red, and it's quite deep under the skin, but it's painful and it wakes me up during the night. Now, I've had nightmares about this, I've had nightmares about what it means, but I have a doctor's appointment tomorrow, And I've basically given myself permission to just feel the catastrophe and experience all the anxiety that needs to happen until I can get to this appointment tomorrow and find out exactly what's going on. And I think this is what women mean when they say it never really leaves you. Because I haven't even had my first annual checkup yet. And I know that that's quite triggering for a lot of women, because there's never a 100% guarantee that it won't come back. We play a statistics game. And while that reassured me when I was making decisions about chemotherapy, and remember, I haven't had radiation and I don't want to take the hormone medications. So now I'm doubting all the decisions that I've made, wondering if I'm going to put my family and myself through more pain and heartache, or I just have to take stock of the thing and go, it's probably just a simple infection that can be treated with a course of antibiotics and we can be on our way. So I am talking to myself about this today, so I remind myself and talk to other women about the catastrophe that we do is normal. It's okay. It's a part of our recovery. If anyone else had to go through what we went through, they would be experiencing the same thing. So I'm going to be okay with this, and I'm going to get through my appointment tomorrow, and it's going to be okay. And you know what? Even if it is stage 4 metastasized cancer, not necessarily a death sentence. It's a reduction in your lifespan. But I guess I'm going to learn how to deal with that too. But I'm not expecting that that's what it's going to be. I've actually convinced myself. Yesterday, I'd convinced myself I was dying from stage 4 breast cancer. Today, I'm pretty convinced that this is an infection that can be fixed by a course of antibiotics. Yay for our emotions.